Hello, my name is Michelle Muza-Moons, and I'm an IBD specialist at the University of Michigan. Welcome to the IBD School 200 series. In this video, we will be talking about C. difficile therapy, including antibiotic treatments with vancomycin and Flagyl, as well as the role of fecal microbial transplant. C. difficile, or C. diff, has become a large problem in our population of IBD patients. In the general population, patients who don't have IBD, usually the first line of therapy for C. diff infection is Flagyl or metronidazole. Flagyl is an antibiotic that does a really good job of helping get rid of C. diff and allowing normal bacteria to be present in the colon and repopulate. It gets rid of the bad bacteria that had taken over, allowing the good bacteria back in. Unfortunately, in patients with IBD, Flagyl or metronidazole is not as effective, and the risk of recurrence after a course of Flagyl is high, and the risk of non-response to Flagyl as a treatment is pretty high as well. So if you have underlying inflammatory bowel disease, either Crohn's colitis or ulcerative colitis, the first round of therapy, if you get diagnosed with C. diff, should be oral vancomycin. Vancomycin used to be administered by IV, but that is not the type of vancomycin that treats a colon infection very well. Therefore, we use oral vancomycin. Patients can either take the oral solution or the capsule form to treat a colon infection. In very severe cases in the hospital, we can also do a vancomycin enema. Vancomycin works well to treat C. diff infections in the colon and acts mostly inside the intestines and isn't absorbed, making it a relatively safe antibiotic. Most patients respond quite well to 2 weeks of therapy. For the patients who have recurrent infection, as discussed in the prior video, we often employ a prolonged taper of vancomycin. During a taper, we use treatment doses for the first 2 weeks and then slowly decrease the amount over 4 to 6 weeks, sometimes even up to 3 months. This decreases the risk of reinfection or recurrence. The prolonged taper has proven to be fairly successful, but there are still patients who finish the taper and the C. diff comes back. Usually on the second recurrence, we recommend that patients see an infectious disease expert. Other potential strategies for treating persistent or recurrent C. diff infection includes different antibiotics, such as fidaxomicin. This drug was designed to treat C. diff infections and is often used for tough, recurrent infections. If a patient is struggling with at least 2 recurrent infections or difficult to treat infection, we recommend they consider fecal microbial transplant, or FMT. An FMT is essentially a stool transplant. Prior to an FMT, the patient sees an infectious disease doctor to make sure we are all in agreement that it is C. diff causing their diarrheal problems. The patient purchases a highly screened, donated, filtered stool from a company, and we infuse the product to the end of the small intestine or colon by colonoscopy. This process does not feel any different than a regular colonoscopy. It's a very well-tolerated procedure, with some patients having a little nausea or upset stomach for 1 or 2 days afterward. FMTs actually have an amazing cure rate for C. diff. In the general population, cure rate is 95 to 97%. In IBD patients, it's a little more challenging, so that rate drops to 82 to 85%, which is still quite good for a treatment of a difficult problem such as C. diff. Sometimes IBD patients require 2 stool transplants in order to completely get rid of their C. diff. In these cases, the success rate is a little over 90% on the second transplant. For some patients, the idea of a stool transplant may be a little unsettling. However, the stool samples are available commercially, and patients simply purchase a vial of stool from our freezer. We do caution patients that we don't understand the long-term side effects of stool transplants. But for patients dealing with recurring C. diff, it has been amazing at helping them get rid of that problem. I'm Michelle Muza-Moons, and thank you for watching IBD School.